Legionnaires' disease is a form of pneumonia with symptoms of fever, tiredness, nausea, diarrhea and confusion, in addition to the coughing and breathlessness associated with other types of pneumonia. It is fatal in around 10% of cases. The infection is caused by a bacteria called Legionella, and the most common species of Legionella bacteria causing Legionnaire's disease is Legionella pneumophila. Legionella bacteria, collectively known as Legionella, can also cause a milder flu-like illness called Pontiac fever and a non-pneumonic legionellosis, which has similar symptoms to Legionnaire's disease but without pneumonia.
Legionella bacteria live throughout the world in natural freshwater environments such as rivers, lakes and streams, where they pose virtually no risk to human health. Although Legionella move freely in both natural and artificial water systems, they attach to solid surfaces to grow and reproduce. Here they form part of a slime layer known as biofilm. Modern artificial water systems have provided new environments where Legionella can flourish, creating a threat to human health unless the systems are well designed and adequately maintained.
In most cases, people are infected with Legionnaire's disease from aerosols containing the bacteria. These aerosols are generated from small droplets of water, but it's not visible droplets that cause infection, it's what's left after the water has evaporated away. This very small particle can then be inhaled deep into the lungs and cause infection.
Legionnaire's disease rarely affects children. It is much more common in adults, in particular groups such as older men, smokers, and people whose immunity is compromised. It is important that Legionnaire's disease is diagnosed as soon as possible because earlier treatment is more effective. Symptoms of Legionnaire's disease usually take from 2 to 10 days to develop after infection, but can take much longer in immunocompromised individuals. The symptoms are very similar to other respiratory diseases, so it can easily go undiagnosed. Earlier diagnosis enables investigations to be started to try and identify the source of infection, thereby preventing further cases.
The most common sources of Legionnaire's disease are cooling towers, spa pools and hot and cold water systems in buildings, including hotels and hospitals. All of these systems can become colonised with Legionella and generate droplets and aerosols. The water system should be designed and maintained to minimise the risk of Legionella and other microorganisms growing. Only approved materials should be used in the construction of water systems. It is essential to carry out regular checks and cleaning of systems to have effective maintenance procedures.
Although some checks or control measures for Legionella require specialist training, many of them are simple, like checking water temperature. Hot water must reach at least 50 degrees Celsius within 1 minute of turning on a tap, and the cold water should remain below 20 degrees Celsius. Running taps allows water to keep flowing and prevents it stagnating. Testing water samples for Legionella is essential in any outbreak investigations to help confirm the sources of infection. Once the potential source of an outbreak has been identified, immediate steps must be taken to make it safe, even before the results of the test are available. Public Health England scientists work with local authority public and environmental health specialists to monitor and respond to outbreaks of waterborne illnesses like Legionnaire's disease.